Frequent young adult heart attacks sound health alarm. Stressful habits like high-pressure work and late nights are accelerating vascular damage. Heart attacks are no longer exclusive to the elderly. Remember the warning signs. Seize the 120-minute golden window for treatment. Embrace healthy living and undergo regular checkups to fortify your heart's defenses. At 3 a.m., the emergency room glowed with bright lights. The beeping of monitors intertwined with the hurried footsteps of medical staff, creating a tense rhythm. When 26-year-old programmer Akai was wheeled into the resuscitation room, the excruciating pain in his chest had already lasted a full 40 minutes. Cold sweat drenched his hospital gown, and his breathing was as labored as an old bellows. He worked overtime for a month straight. Last night, after finishing the project, he suddenly couldn't breathe. We thought he was just exhausted, so he leaned back in his chair to rest. When that didn't help, we rushed him here. His colleague, clutching Akai's backpack, spoke with trembling voice. In the corridor outside the resuscitation room, family members arriving one after another looked ashen. They kept asking the nurses, "So young, how could it be a heart attack?" Finally, the doctor emerged holding the ECG and cardiac marker test reports, sending a collective chill through everyone. Acute street elevation myocardial infarction STEMI, the most dangerous type of heart attack. This condition, long perceived as exclusive to the elderly, is now silently targeting young people. Under intense pressure at an alarming rate, Akai's emergency treatment lasted 3 hours. Doctors successfully reopened his blocked left anterior descending artery through emergency PCI surgery. When the catheterization lab door opened, the attending physician removed his mask. His voice tinged with relief yet heavy with gravity. Another half hour, and the area of myocardial necrosis would have expanded significantly. Even if he survived, he might have been left with severe heart failure complications. Such critical emergencies are increasingly common in emergency rooms across major hospitals nationwide. The latest 2025 China Cardiovascular Health and Disease report from the National Center for Cardiovascular Diseases reveals that cardiovascular disease now affects 330 million people in China, equivalent to 1 in every 4 citizens. Among them, 245 million suffer from hypertension, while over 10 million each have coronary heart disease or stroke. More alarmingly, cardiovascular diseases account for nearly 50% of all deaths among residents, meaning 1 in every 2 deaths is caused by a cardiovascular event. We used to label coronary heart disease as an elderly disease, but clinical data has completely overturned this perception. Gao Ying, chief physician of cardiology at Fuwai Hospital of the Chinese Academy of Medical Sciences, stated in an interview that over the past 5 years, the annual growth rate of myocardial infarction patients under 45 has reached 8.3%. Among them, the proportion of young patients aged 25 to 35 has risen from 3.5% a decade ago to 12.8% today. Young professionals, particularly those in high-pressure industries like internet, finance and media, have become a high-risk group for myocardial infarction. Dr. Gao's clinic once treated a patient as young as 22, a designer who frequently pulled all-nighters to meet deadlines. Having worked through 2 consecutive nights before the attack, these young patients share common traits: chronic sleep deprivation, irregular eating habits, lack of exercise, and a tendency to ignore their body's warning signs. Why do young hearts suddenly shut down? To answer this, we must first examine the heart, this intricate life pump. If the human body is likened to a city operating day and night, the heart is its central power plant, and the coronary arteries are the high-voltage cables delivering energy to this plant. Unlike other blood vessels that supply organs, these arteries exclusively provide oxygen and nutrients to the heart muscle itself. Under normal conditions, the inner walls of these cables are smooth as glass, with unobstructed lumens allowing blood to flow freely at 30 centimeters per second. This ensures the heart muscle receives ample energy during both contraction and relaxation. However, much like water pipes that accumulate scale when neglected, long-term unhealthy habits such as high-fat, high-salt diets, sleep deprivation, and smoking cause lipids like cholesterol and triglycerides to deposit on the vessel walls like garbage. These gradually form yellow atherosclerotic plaques, These plaques start out soft and rice grain-sized, causing no discomfort. Over time, however, they gradually enlarge and harden like stones growing inside the vessels, constantly squeezing the lumen space. Director Gao Ying explains that this process, medically termed atherosclerosis, isn't sudden but a chronic progression spanning 10 to 20 years. For younger individuals, although blood vessels retain relatively good elasticity, long-term and healthy lifestyle habits can accelerate plaque formation and progression. This is analogous to using a high-pressure water jet to clean the inner walls of water pipes, which causes scale to accumulate more rapidly. These plaques are like time bombs. They may remain dormant under normal conditions, but once triggered, they can explode. Director Gao Ying further explains that when coronary artery narrowing exceeds 70%, the heart experiences insufficient blood supply during increased oxygen demand, such as during exercise or emotional stress, leading to angina. If the plaque ruptures, the exposed core material rapidly activates the coagulation system, causing platelets and fibrin to aggregate at the rupture site and form a thrombus. This thrombus forms extremely rapidly, capable of completely blocking the vessel within minutes, akin to suddenly cementing a high-voltage cable, causing an instant power outage at the power station. Myocardial cells then undergo necrosis due to severe oxygen deprivation. This is the fatal acute myocardial infarction. Clinical research data shows that when a plaque completely blocks a vessel, the incidence of myocardial infarction approaches 100%. The golden window for treatment is only 120 minutes to 2 hours. Within these 2 hours, the timely reopening of the blocked vessel directly determines the patient's survival and prognosis. Beyond this time frame, every minute of delay causes massive myocardial cell death, significantly increasing mortality rates. Even if the patient survives, they may suffer severe sequelae such as heart failure or arrhythmia. What's more alarming is that many young people already have damaged heart wiring without any noticeable symptoms. Take Akai, for example. In the month before his attack, he frequently experienced chest tightness and fatigue during overtime work, even having 2 episodes of mild chest pain. Yet he dismissed these as normal fatigue from working late, assuming they would ease with a few minutes rest, and paid them no mind. This type of myocardial ischemia without obvious symptoms is medically termed silent myocardial ischemia. It acts like a silent bomb, serving as a major trigger for sudden cardiac death in young adults. Data indicates that approximately 60% of angina patients exhibit atypical symptoms. Beyond chest tightness and pain, these may manifest as nausea, vomiting, insomnia, indigestion, jaw pain, or left shoulder pain. Such symptoms are often misdiagnosed as gastrointestinal disorders, cervical spondylosis, or other conditions, leading to delayed treatment. Liu Yangji, Secretary and Director of the Liuliting Community Health Service Center in Beijing's Chaoyang District, encountered such a case during community consultations. A 32-year-old delivery worker experienced persistent dull pain in his upper abdomen for half a month. Assuming it was food poisoning, he self-medicated with stomach medicine to no avail. It wasn't until he suddenly collapsed while making a delivery that he was rushed to the hospital and diagnosed with acute inferior wall myocardial infarction. The pain from inferior wall myocardial infarction can sometimes radiate to the upper abdomen, easily mistaken for a stomach problem, Director Liu noted. Community hospitals see multiple such misdiagnosed cases annually, particularly among young people who assume they are too healthy to develop elderly diseases. They often self-diagnose and self-medicate when feeling unwell, only seeking hospital care when symptoms worsen, missing the optimal treatment window. In reality, the heart's warning signals are not entirely elusive. With careful observation, patterns can be discerned. Director Gao Ying summarized common warning signs preceding a heart attack. The most typical is a palm-sized sensation of pressure or tightness behind the sternum or in the precordial area, akin to a heavy weight pressing on the chest, making breathing difficult. This discomfort may radiate to the left shoulder, left arm, ring finger, little finger, or even the neck, jaw, and throat. These symptoms are often triggered by strenuous exercise, emotional stress, overeating, cold exposure, or smoking and drinking. Angina typically lasts 3 to 5 minutes and can be relieved by rest or sublingual nitroglycerin. In contrast, Acute myocardial infarction causes pain or discomfort lasting over 20 minutes, sometimes exceeding 30 minutes, that cannot be relieved by rest or standard medications. It may also be accompanied by profuse sweating, shortness of breath, and a sense of impending doom. Immediate emergency medical assistance must be sought by dialing 120 without delay. Akai's condition became critically severe precisely because he missed the optimal window for treatment, recalled the emergency physician who responded to his case. After experiencing severe chest pain, Akai did not immediately call 120. Instead, he pushed through to finish his work and walked downstairs to hail a taxi to the hospital, delaying treatment by nearly an hour. During an acute myocardial infarction, the heart is already under critical stress. Any physical activity further burdens the heart and enlarges the infarct area. The doctor emphasized that the correct course of action at this point is immediately cease all activity, lie flat on the spot to rest, and call 120. If nitroglycerin or quick-acting heart pills are available and there is no known allergy to these medications, they may be taken according to the instructions. If possible, oxygen should be administered promptly to alleviate myocardial hypoxia. Furthermore, without a confirmed diagnosis or knowledge of drug allergies, taking other medications is strictly prohibited. Professional treatment must await the arrival of 120 emergency personnel. November 20th is designated as China Heart Attack Treatment Day to reinforce public awareness of the 120s. First, immediately call 120 emergency services upon experiencing acute chest pain symptoms. Second, after an acute myocardial infarction is confirmed, effective treatment must be completed within 120 minutes. Data from the National Center for Cardiovascular Diseases indicates that the average treatment time for myocardial infarction patients in China still exceeds 150 minutes. A significant portion of this delay is attributable to patients themselves, including unfamiliarity with symptoms, hesitation about seeking medical care, and attempting to reach the hospital independently. Therefore, enhancing the public's ability to recognize myocardial infarction symptoms and their awareness of emergency response is crucial for reducing mortality rates. So, who is more susceptible to heart disease? Beyond traditional high-risk groups like the elderly, diabetics, hypertensive patients, those with hyperlipidemia, obese individuals, smokers, and those with a family history of coronary heart disease. Young adults who frequently work overtime, stay up late, and experience high emotional stress have emerged as a new high-risk cohort. Director Gao Ying explains that prolonged work-related stress forces the heart into a state of overclocked operation, causing sustained sympathetic nervous system activation. This accelerates heart rate, elevates blood pressure, and increases cardiac oxygen consumption and workload. Emotional fluctuations like anxiety and irritability disrupt hormone levels akin to voltage instability, impairing normal vascular contraction and relaxation while accelerating plaque rupture. Combined with unhealthy habits like prolonged sitting, irregular eating patterns, and lack of exercise, these factors collectively plant multiple hidden dangers for the heart. During World Heart Day on September 29, 2025, the public science outreach event Shingles, a heartache proactive joint prevention, hosted by Health News, was held in Beijing. A groundbreaking study unveiled at the event drew significant attention. Cardiovascular diseases and infectious diseases exhibit a bidirectional relationship. Cardiovascular patients face a 39% higher risk of developing shingles compared to the general population, while shingles patients experience a 68% increased risk of myocardial infarction shortly after onset, each condition posing a hidden threat to the other. Dr. Wei Aihua, Director of Dermatology at Beijing Tongren Hospital affiliated with Capital Medical University, explained that shingles, commonly known as snake chanyao, snake-wrapped waist, is caused by the reactivation of the varicella zoster virus VZV dormant in human nerve ganglia. Over 90% of the population carries this latent virus. For cardiovascular patients, the severe neuralgia triggered by shingles acts like a trigger, causing accelerated heart rate and sudden blood pressure spikes that directly increase cardiac load. Prolonged sleep disturbances and persistent stress may further induce arrhythmias. Myocardial ischemia, or even trigger recurrent episodes of previously controlled angina. Director Wei Aihua shared a real-life case. A 65-year-old coronary heart disease patient developed shingles during winter, presenting with extensive blisters on his chest and back accompanied by severe neuralgia that kept him awake all night. On the 5th day of illness, he suffered an acute myocardial infarction and died despite emergency treatment. The autopsy revealed that plaque rupture in his coronary artery formed a thrombus that completely blocked the vessel. A key factor triggering the plaque rupture was the intense pain and stress response caused by the shingles. For cardiovascular disease patients, shingles is not merely a skin condition, it poses a hidden threat to the heart, emphasized Dr. Wei. Director Wei Aihua emphasized that preventing shingles is crucial for protecting heart health, and vaccination is one of the most effective means of prevention. This is especially true for middle-aged and elderly individuals aged 50 and above, well as those with chronic conditions such as hypertension, hyperlipidemia, and coronary heart disease. Vaccination during stable periods of these conditions can build a dual defense for cardiovascular health and immunity. Data from the China White Paper on Cardiovascular and Cerebrovascular Health in Young and Middle-Aged Adults further reveals the cardiovascular health status of the younger demographic. Among surveyed individuals aged 20 to 59, those aged 20 to 39 accounted for 44.3% of patients or high-risk individuals, with those aged 20 to 29 alone reaching 15.3%. These figures indicate that cardiovascular health is no longer solely a concern for middle-aged and elderly individuals. Young adults must also take it seriously. So how can we safeguard our hearts? In fact, everyone can adopt simple preventive measures. Just as power plants require regular maintenance, our hearts need daily care. First, quit smoking and avoid secondhand smoke to prevent accelerated aging of your wiring. Smoking is a confirmed risk factor for cardiovascular disease. Harmful substances in tobacco, such as nicotine and tar, damage the vascular endothelium, accelerate atherosclerosis, and simultaneously increase heart rate and blood pressure, raising the risk of plaque rupture and thrombosis. Data shows smokers face a 2 to 4 times higher risk of coronary heart disease than non-smokers. However, quitting smoking gradually reduces cardiovascular disease risk. After 5 years of abstinence, the risk of myocardial infarction drops by 50%. Furthermore, secondhand smoke possesses severe cardiovascular toxicity. Long-term exposure increases non-smokers' risk of cardiovascular disease by 25% to 30%. Therefore, quitting smoking protects not only yourself but also the health of those around you. Second, maintain a healthy body mass index (BMI) to avoid overburdening the heart. BMI is calculated by dividing weight kilogram by height meter squared. According to Chinese standards, a BMI between 18.5 to 23.9 is considered normal. 24-27.9 indicates overweight, and is greater than or equal to 28 signifies obesity. Obesity, particularly abdominal obesity, can lead to abnormalities in multiple indicators such as blood lipids, blood sugar, and blood pressure, increasing the burden on the heart. Research indicates that for every 1 unit increase in BMI, the risk of coronary heart disease increases by 5%. For overweight and obese individuals, weight loss through proper diet and exercise, even just 5% to 10% of body weight, can significantly reduce the risk of cardiovascular disease. Third, maintain regular, moderate physical activity to invigorate your cardiovascular system. The 2022 American College of Cardiology and American Heart Association Joint Guidelines for Primary Prevention of Cardiovascular Disease explicitly recommend adults engage in at least 150 minutes of moderate intensity aerobic exercise or no less than 75 minutes of vigorous intensity aerobic exercise weekly. Aerobic exercises include brisk walking, jogging, swimming, cycling, and square dancing, as well as other types such as sprinting, jumping rope, basketball, and soccer. Consistent exercise enhances cardiopulmonary function, accelerates blood circulation, and boosts metabolism. It aids in weight management, regulates blood lipids and blood pressure, thereby reducing the risk of cardiovascular disease. For young professionals, even with demanding schedules, Fragmented time can be utilized for exercise such as getting off public transit one stop early for a walk to work, doing 10 minutes of stretching during lunch breaks, or scheduling outdoor cycling or hiking on weekends. Fourth, establish healthy eating habits to provide the heart with high-quality fuel. A healthy diet forms the foundation of cardiovascular disease prevention. The National Center for Cardiovascular Diseases Dietary Guidelines for Cardiovascular Health in Chinese Residents recommends adhering to the principle of more vegetables, more fruits, more whole grains, more soy products, more fish, less red meat, less salt, less sugar, less oil. Specifically, consume at least 200 grams of fish or seafood weekly. The unsaturated fatty acids in fish protect cardiovascular health. Daily vegetable and fruit intake should exceed 500 grams. Calculated based on raw weight. The vitamins, minerals, and dietary fiber in these foods help regulate blood lipids and protect vascular endothelium. Daily soy product intake should ideally reach 100 grams, equivalent to 1 cup of soy milk or 1 block of tofu. Red meat consumption should be limited to under 75 grams daily, as excessive intake increases the risk of dyslipidemia. Simultaneously, limit salt intake. The World Health Organization recommends daily salt consumption below 6 grams, as excessive salt can elevate blood pressure. Additionally, restrict alcohol consumption, as excessive drinking damages blood vessels, raises blood pressure and lipids, and increases cardiovascular disease risk. Fifth, regularly monitor and maintain physiological and biochemical indicators in a stable state, which is a core measure for preventing cardiovascular disease. Specifically, this encompasses 3 key areas. First, blood pressure management. The ideal blood pressure target is below 128 mmHg. Healthy individuals should have their blood pressure measured regularly, ideally at least once a year. Those with risk factors such as a family history of hypertension, obesity, or chronic sleep deprivation should increase the frequency of monitoring. In daily life, maintaining blood pressure stability can be effectively achieved through salt restriction, a light diet, regular exercise, smoking cessation, and limiting alcohol consumption. If diagnosed with hypertension, medications should be taken regularly under medical supervision. Never discontinue or reduce doses without consulting a doctor. Second, lipid management focuses on controlling serum total cholesterol and low-density lipoprotein (LDL) cholesterol levels, which are core drivers of atherosclerosis. Elevated levels significantly increase the risk of coronary heart disease and myocardial infarction. Adults are advised to undergo annual lipid testing, with high-risk individuals requiring testing every 6 months. Most individuals can maintain normal lipid levels through dietary adjustments and exercise. Persistently elevated levels necessitate medication as prescribed by a physician. Third, manage blood glucose levels. The ideal fasting blood glucose target is below 5.6 mol. Elevated blood sugar damages blood vessels and nerves, triggering various cardiovascular complications. Regular blood glucose monitoring is essential, with prompt intervention upon detecting abnormalities. Diabetics must strictly adhere to medical guidance for blood glucose control to avoid excessive fluctuations. Sixth, heighten awareness of bodily signals and manage emotions to prevent placing additional strain on the heart. In fast-paced work environments, many young professionals become overly absorbed in their tasks, often overlooking warning signs from their bodies such as dizziness or headaches with elevated blood pressure, or palpitations and chest tightness with accelerated heart rate. These signals serve as reminders that rest and adjustment are needed. Persistent disregard can allow minor issues to escalate into significant health risks. Simultaneously, emotional regulation is crucial. Persistent exposure to high stress and anxiety elevates stress hormones like adrenaline and cortisol, directly impacting heart rate and blood pressure while increasing cardiac load. Young adults must learn to recognize emotional shifts and master effective coping strategies such as releasing tension through exercise, music, or social interaction. Maintain emotional equilibrium, avoiding prolonged high-pressure work, eliminating late nights, and establishing regular sleep patterns are vital for maintaining physical and mental health stability. Beyond individual prevention, China is also intensifying efforts in population-level cardiovascular disease control. In recent years, regions across the country have advanced intelligent prevention and control initiatives, leveraging big data and artificial intelligence to enable early warning and closed-loop management for high-risk populations. Ningbo City exemplifies this approach. Led by the Ningbo Clinical Guiding Center for Cardiovascular Disease Prevention and Control, a multidisciplinary team developed the ASCVD Intelligent Prevention and Control Platform. By integrating billions of data points including physical examination results, electronic medical records, and pharmacy logs, the platform constructs dynamic risk assessment models for real-time monitoring of individuals with 3 highs and 1 heavy: high blood pressure, high blood sugar, high blood lipids, and heavy smoking, alcohol consumption. Doctors at Milin Subdistrict Community Health Service Center in Ningha County once identified a high-risk case through this platform. When 81-year-old Ms. Zhang was dispensing medication at the community hospital, the system suddenly triggered a yellow alert, indicating progressive carotid plaque risk and poor blood pressure control. Acting on the alert, the doctor immediately arranged carotid ultrasound and comprehensive cardiovascular examinations for Zhang. The tests confirmed enlarged carotid plaques with potential instability. The doctor adjusted her treatment plan, placed her under intensive management, and initiated regular follow-ups. Through the platform's intervention, Zhang's blood pressure stabilized and plaque progression was effectively curbed. Data from Ningbo's Clinical Guidance Center for Cardiovascular Disease Prevention indicates that since the platform's launch, early screening rates among high-risk populations have increased by 40%, while myocardial infarction and stroke incidence rates have decreased by 18%. Simultaneously, the platform employs gamified tasks such as daily medication checking for points and a family co-management model, enabling relatives to view patients' health data. This has significantly improved medication adherence, rising from 52% to 89%. Community health service institutions, serving as the last mile in cardiovascular disease prevention and control, are playing an increasingly vital role. The Liyulatan Community Health Service Center in Beijing's Qiyang district has established a dedicated cardiovascular disease prevention clinic, offering free blood pressure and blood glucose testing alongside personalized health guidance. Director Liu Yangji explains that community doctors conduct regular follow-ups with hypertension and coronary heart disease patients in their jurisdiction, monitoring medication adherence and health status to adjust treatment plans promptly. Additionally, the community regularly hosts cardiovascular health education lectures, inviting specialists from top-tier hospitals to share disease prevention knowledge and enhance residents' health awareness. Many elderly individuals find it difficult to visit large hospitals due to mobility issues. Community health centers can provide them with convenient diagnostic and management services, ensuring the practical implementation of cardiovascular disease prevention and control, said Director Liu Yangji. Internationally, there are also many valuable experiences to draw upon in cardiovascular disease prevention and control. The U.S. Million Hearts Initiative is a nationwide heart health campaign jointly launched by the federal government, the Centers for Medicare and Medicaid Services (CMS), and the Centers for Disease Control and Prevention (CDC). Commencing in 2012 with 5-year implementation cycles, its core objective is to reduce 1 million cases of heart attacks and strokes every 5 years. Led by the Federal Medicare Agency, the program garnered widespread support from governments at all levels, medical institutions, and patient groups. Through measures such as building healthy communities, optimizing healthcare quality, and advancing health equity, the initiative achieved significant results, reducing the incidence of myocardial infarction in the United States by 23% during its implementation period. The program's official website regularly publishes work plans and data reports, transparently sharing progress and outcomes while providing a wealth of prevention tools and clinical protocols for public and healthcare professionals to access and utilize. Returning to a case story, 1 week later, having narrowly escaped death, he was finally transferred out of the ICU to a general ward for continued treatment. Lying in his hospital bed, gazing at the sunlight streaming through the window, he couldn't help but reflect, I used to think youth was my capital. Pushing myself to the limit was no big deal. Even if it meant exhaustion or pulling all-nighters, it didn't matter. Now I realize the heart never gives a second chance to those who overdraw their health. During his hospitalization, Akai's colleagues visited him, bringing company care packages and expressing their resolve to learn from his experience and prioritize their own health. Akai stated that after his recovery and discharge, he plans to switch to a job with a more moderate workload. He also intends to develop habits of regular exercise and healthy eating, undergo regular physical checkups, and never again trade his health for work performance. Akai's experience epitomizes countless young cardiovascular disease patients. Sounding an alarm for all young professionals, the heart's warning signals never appear suddenly. The fatigue, chest tightness, and irritability we overlook are all distress signals from our bodies. In this fast-paced era, we all strive for livelihoods and dreams. But let us not forget that health is the foundation of everything. Learning to listen to your heart, practicing daily prevention and management, regularly monitoring health indicators, and promptly addressing risk factors are the most responsible choices you can make for yourself. Data from the National Center for Cardiovascular Diseases reveals that preventing and controlling cardiovascular diseases remains a long journey. Yet by starting with ourselves, making small changes in daily life, cultivating healthy habits, and raising health awareness, we can effectively reduce our risk of developing these conditions. Simultaneously, leveraging intelligent prevention platforms and community health services to establish a collaborative framework involving individuals, families, and medical institutions will fortify our defenses for heart health. After all, no task is more important than preserving life itself. No matter how busy life gets, we must allow our hearts some breathing room. Let us begin now to proactively prioritize heart health, ward off the threat of cardiovascular disease, and embrace a brighter future with a healthy body. It is worth noting that September 29 is World Heart Day. With the 2025 theme being Keep Beating, this theme not only reminds us to maintain our heart's regular rhythm but also signifies the importance of embracing an active, healthy lifestyle to keep our lives vibrant. On this special day, diverse science outreach activities and public awareness campaigns are held across regions to enhance public attention and concern for cardiovascular health. We hope more people will seize this opportunity to proactively learn about cardiovascular health and actively participate in heart health protection initiatives, ensuring our heart keeps beating to safeguard our lives. Finally, let us reiterate these vital health principles. Recognize the warning signs of a heart attack and call 120 immediately if discomfort arises. Seize the critical 120-minute golden window for treatment without delay. Commit to healthy habits, quit smoking, limit alcohol, exercise regularly, eat sensibly, and maintain emotional stability. Undergo regular health checkups to monitor blood pressure, blood lipids, blood sugar, and other vital indicators. High-risk individuals should promptly receive the shingles vaccine to build a dual line of defense. These simple principles can save lives in critical moments. Let us share this knowledge with everyone around us, collectively safeguarding our heart health. May the tense scenes in emergency rooms at 3 a.m. become increasingly rare. May more people enjoy healthy hearts and fulfilling lives.